Assessment of central venous pressure. When assessing central venous pressure, the first and most important thing is to identify anatomic landmarks so you know what the path of the internal jugular vein is. The important landmarks to identify, I'm working on the right side of the body, the clavicle, which is right here, and the two heads of the sternocleidomastoid, the sternal head and the clavicular head. And the triangle is formed by the clavicular, sternal, and clavicle. In this triangle, up through this point, is where the internal jugular runs, which is just lateral to the carotid artery. Other anatomic landmarks, the external jugular vein, you can see pulsating here. It's not as reliable an indicator of central venous pressure because it does not take a direct path to the right atria, and it sometimes has valves. In this case, it's clearly prominent. If you were having problems discerning it, if you ask the patient to valsalva or bear down like they're having a bowel movement, it will become very prominent. Can you bear down like you're having a bowel movement? You can see that both external and the accessory external are prominent. Okay, relax. So you've identified the anatomic area through which the internal jugular runs, and you look for pulsations that are not carotid and not external jugular. That might represent the pulsations from the internal jugular vein and the height of the pressure wave. In this case, we can see this right here. The pressure wave has a multiphasic appearance similar to the produced by the AC and V waves. It is distinct from the carotid, which has a single sharp upstroke. Looking at this area, if we push on the right upper quadrant of the patient's abdomen, we can recruit blood from the liver and have it fill out the internal jugular. So I'm going to focus on the pulsations from the internal jugular, and now I'm going to push on the right upper quadrant, and it will make those pulsations more prominent. And it's subtle, but it is more prominent. The same effect will happen with the external jugular, so I'm going to do the same thing. There's the external pulsations. I'm now going to push on the right upper quadrant right now, and you can see that the filling becomes more prominent. The last aspect of assessment of central venous pressure is the actual measurement of the pressure itself, or estimation. In order to measure the height of the central venous pressure, we start at the angle of Louis, which is the sternocleidomastoid juncture, which can be identified by palpation as approximately right here. We measure the vertical distance of the top of the pulse wave from this point. So if the pulse wave is up here, we draw a line out that's parallel to the ground, and then we assess what the height of that point would be above the sternocleidomastoid angle. Again, it'd be quite elevated in this setting.